Today's topic is oral submucous fibrosis. ओरल सबम्यूकस फाइब्रोसिस एक क्रोनिक और पोटेंशियली कैंसर में ट्रांसफॉर्म होने वाला कंडीशन है। यह मेनली ओरल म्यूकोसा को अफेक्ट करता है और आज के टाइम में स्पेशली इंडिया और साउथ ईस्ट एशिया में यह एक मेजर हेल्थ कंसर्न बन गया है। Oral submucous fibrosis is a chronic, insidious, potentially malignant disorder that affects the oral mucosa as well as the pharynx and the upper two-thirds of the esophagus. It is characterized by progressive fibrosis of the submucosal tissues, resulting in stiffness of the oral mucosa, leading to restricted mouth opening, intolerance to spicy food, and eventual dysphagia and speech difficulties. OSMF एक प्री कैंसरस लेजन है जिसमें ओरल सबम्यूकोसा स्लोली स्टीफ होने लगता है ड्यू टू फाइब्रोसिस मींस टिश्यू में ज्यादा कोलाजन फाइबर कलेक्ट होने लगता है। इस वजह से पेशेंट को माउथ ओपनिंग में प्रॉब्लम होती है। प्रिंसिपल एटियोलॉजिकल एजेंट फॉर ओरल सबम्यूकस फाइब्रोसिस इज एरेका नट चेविंग। एरेका नट contains एरिकोलिन which stimulates fibroblasts. It increases collagen synthesis and inhibit collagenase, thus reduces collagen degradation and fibrous band formation occurs. Second is tobacco. Tobacco contributes to epithelial atrophy and carcinogenesis. It has synergistic effect with areca nut. A genetic predisposition is also supported by association with specific human leukocyte antigen molecules such as human leukocyte antigen A10 and human leukocyte antigen B7. In initial phase of oral submucous fibrosis, irritants trigger chronic inflammation in the submucosa. Then upregulation of transforming growth factor beta and other cytokines. In proliferative phase, fibroblast proliferation. Then it enhances collagen synthesis type 1 and type 3. In remodeling phase, collagen degradation inhibited by downregulation of matrix metalloproteinases. Fibrosis and hyalinization of connective tissue occurs. It reduced vascularity leads to epithelial atrophy. Early symptoms of oral submucous fibrosis are burning sensation in the mouth, especially with spicy food, xerostomia, that is dryness of mouth, vesicles or ulcerations, pigmentation changes in oral mucosa, stiffness of oral mucosa begins. In progressive symptoms, palpable fibrous band in buccal mucosa, pharynx and upper two-thirds of the esophagus, blanching of mucosa seen, mucosal texture feels tough and leathery, decreased mobility of the soft palate and tongue, and loss of tongue papilla occurs. In advanced stage, we can see speech and swallowing difficulties, nasal voice due to soft palate involvement, trismus, mouth opening restricted, and it is less than 20 mm, pain and ulceration due to super added infections, and weight loss due to reduced oral intake. In early lesions of oral submucous fibrosis, under the microscope we can see edema, dilated blood vessels, juxtaepithelial inflammatory reactions, infiltration by eosinophil lymphocyte and plasma cells. In advanced lesion of oral submucous fibrosis, hyalinization of subepithelial collagen seen, atrophic epithelium with flattening of red rays, occluded blood vessel, and in late stage of oral submucous fibrosis, we can see degradation of muscle fiber. Molecular markers: transforming growth factor beta, connective tissue growth factor, matrix metalloproteinases, which are zinc-dependent proteolytic enzyme, and tissue inhibitor of metalloproteinases are implicated. P53 mutations and loss of heterozygosity in genes related to tumor suppression are observed in malignant transformation. According to Khanna and Andrade 1995, based on clinical and functional limitations, there is no significant restricted mouth opening in stage 1. In stage 2, restricted mouth opening between 25 to 35 mm. In stage 3, restricted mouth opening between 15 to 25 mm. In stage 4A, there is less than 15 mm mouth opening. In stage 4B, malignant transformation occurs. Diagnosis of oral submucous fibrosis mainly based on clinical examination, palpation of fibrous bands, measurement of mouth opening, interincisal distance. Biopsy confirms diagnosis and rules out the dysplasia or carcinoma. Imaging including ultrasound, MRI, assess extent and density of fibrosis. CT scan useful in planning surgical interventions. Treatment: immediate discontinuation of areca nut, tobacco and alcohol. We can give nutritional supplement, antioxidants to reduce free radical damage, intralesional steroids, forceful mouth opening exercises. We can use jaw stretching devices, surgical management only for severe cases with functional impairment, fibrotomy, excision of fibrous bands, grafting, buccal fat pads, split thickness skin grafts, coronoidectomy in case of coronoid process involvement, and laser surgery. Complication of oral submucous fibrosis is risk of malignant transformation, that is 7 to 13%. Progressive condition with no spontaneous regression, psychological and nutritional impact due to oral dysfunctions. Public awareness campaign can help to educate the people about the dangers of areca nut and tobacco use. School and community-based screening programs, enforcement of legal restriction on the areca products. So, spread awareness. Thank you for watching.